Hello, and welcome to our discussion on mental health in the midst of COVID-19. My name is Rebecca, and I am part of the Olivis team here at the University of Miami. The Olivis Research Program is from the National Institutes of Health, or NIH, and is a national effort to help build one of the most diverse health databases in history. Researchers will use the health data that we collect to learn how our lifestyle, biology, and environment affect individual health. This health data can then help develop better treatment and care and new ways to prevent different diseases for all of us. Today, we are partnering with the City of Doral to help bring awareness around the topic of mental health. Part of the mission at All of Us is to help ensure overall healthcare is better for future generations. Mental health is especially important to talk about because we are in a time of such uncertainty, and our emotional, psychological, and social well being are just as crucial as our physical health, and they can all impact one another. I am honored to be joined by the mayor of the city of Doral, Juan Bermudez, and the chief of the Division of General Internal Medicine at Dr. Ovin Carrasquillo. Juan Carlos Bermudez, also known as JC, is the founding mayor of the city of Doral. He is currently a member of the advisory board of the United States Conference of Mayors, as well as a board member of the Miami-Dade County Transportation Planning Organization. Mayor Bermudez graduated from the University of Miami with a Bachelor of Arts degree and received his law degree from the University of Notre Dame Law School. He has practiced law in South Florida for over 28 years and is a member of the Florida Bar and the American Bar Association, amongst other legal associations. Dr. Ovin Carrasquillo is a national expert in minority health, health disparities, and community-based participatory research. As the chief of the Division of General Internal Medicine at the University of Miami, he has served as a professor of medicine and public health sciences at UM's Miller School of Medicine, and he has actually been on the front lines with Hugo Health during this pandemic. He has over 20 years of experience leading large NIH-centered grants and randomized trials, totaling over $60 million in funding. One of these grants actually includes the Olivis Research Program, where he serves as one of the principal investigators. I'd like to thank you both so much for joining the conversation today. And to start things off, I'm actually going to pass the torch to Dr. Carrasquillo and Mayor Bermudez. So, Dr. C, why don't you start by telling us why mental health is so important, especially right now?
Thank you. And first, a shout out to the mayor. Obviously, not only is he a fellow Canes, but I could tell you, I'm so impressed every time I drive through Doral for something, how that city's moving up, all the progress. I mean, you just go there a few months later. I mean, it's clearly a city way up on the positives. I'm really impressed. So shout out. It's always great to see a fellow Canes doing a wonderful work up there. So that's true. But again, thank you, Mayor, for having this critically important event. Because mental health is clearly a major concern of us doctors during the COVID. It's always been a major concern. I'm a primary care doctor, internal medicine, and I can tell you, I mean, at least half my practice, it's, dealing with illnesses that have an additional mental health component. So that's always been critically important. But with COVID, it's really been a major concern of many of our patients and our providers as well, both in the hospital and the outpatients. COVID, as you know, poses unique challenges to people. As I tell everybody, mental health, everyone thinks it's, specific disease of somebody. Mental health affects everybody. It's something that's true for everybody. Your ability to cope with stress versus your coping skills. And, COVID just has really turned out unbalanced. So it's something that I expect of everybody. Impacts on depression, on isolation, compound everything else that's happening in our lives. And every time we turn on the TV, it just heightens that. So again, thank you very much, because it's critically important to the COVID era. So thank you for doing this.
Yeah, well, doctor, for us, it's a great opportunity, obviously. And as a public policymaker, I can tell you that I have there's a lot of concerns that have come about as a result of COVID. And obviously, some of them are physical or medical, let's say. But I think the two sequela that I think we as policymakers are very concerned with moving forward are, number one, economics, obviously, because there has been an impact. And I believe certainly that cities and the economy nationwide and down here in South Florida will be impacted even beyond the time period when we can find a vaccine for COVID. But the second thing that I think has been a big issue is mental health. I can tell you that I believe that, as you correctly stated before, we may have already had some issues with mental health, but I believe they've really been augmented by the COVID crisis. I see it in the young, I see it in the middle aged, I see it in the elderly. Um, we see it with our, neighborhood resource policing. We see it with people asking us for certain help. And I was talking to some of my fellow policymakers in the Miami-Dade County League of Cities. One of the things that I've continued to reiterate, not only to the other mayors, but also to Mayor Jimenez, is that I believe that coming out of the COVID crisis, there needs to be a renewed focus on mental health, because this has been a very difficult time that I think has heightened a lot of issues that may have been there before, but have just now really come to the forefront. And I really applaud what the All of Us Research Program is doing, what you are doing, because you are correct. Whether it's, and I see it in my 10-year-old daughter who's now went back to school, and I see it in some of the members of our Silver Club who haven't been able to meet, and that was really their get together, which is our group of 65 and over elderly. They got together every week, and they haven't been able to get together since this whole process started.
Thank you. I think one of the questions you wanted to know is, how are we as doctors coping? Because one of the things is doctors stay healthy. So it has been really hard on doctors. There's always been a phrase. I don't know if the rest of the public knows. It's called provider burnout or doctor burnout. It's been a lot in the news, but COVID has really made that. The increasing work demands on us, especially in the hospital, but also dealing, the volume of emails, concerns just from our patients and our clinics because of all the anxiety related to COVID has been dramatically increased. And we as doctors can't walk away from that. So it makes it really hard, the additional stress on top of everything else. I can tell you, when I was, in July, the peak of the epidemic, I spent a week in Jackson. And I told my family I moved out. We have a small studio out on the beach, and I moved out. I would show them pictures. Hey, this is me wearing the whole full COVID outfit. I don't know if regular people have seen what the doctors wear in the COVID unit. And for a week, I was separated from my family, as an example. So it has been hard, and we try to develop a lot of strategies for our doctors how to deal with the burnout, because it's certainly been true for our providers as well. So it's not just our patients; it's us ourselves.
Yeah, I think, doctor, that we had a program here where we actually took to each one of our medical facilities, and also to our providers, our police and our fire department meals, to thank them. We did it with a restaurant here. It was a program of being on the front lines, and we were able to visit each and every one of the major healthcare facilities that were here or are here in Doral. And, I know it has to be extremely stressful, especially on the families. I mean, from my perspective as a mayor, it's been a lot more stressful for me, trust me. And, I've had to be here along with some members of the administration, because many were not here. So I can imagine it's got to be much more difficult for you. And really, if there's anybody we got to thank, is all of you who've been on the front line during this such difficult times.
That made a real, I could tell you, speaking to the faculty, but more importantly, the hospital staff, the level of support from the public for the work they were doing, especially when when it was really peaking in July and things were really tenuous there for a while. It was a little bit touch and go. That made a humongous difference. Me personally, when I was driving from the beach on 195, I don't know if you've seen it. There's a big billboard that has a healthcare angel holding, the world. And those are really positive, uplifting messages for a lot of the healthcare workers that we got. So that made a difference. We also, it's important, even though you're doing this, to take time for yourself. I could tell you, when I was out there, I forced myself to run for 45 minutes every day. And running, sweating up and running, and it just cleared the whole mind, for me, who's not, a seasoned athlete, sweating for 45 minutes out there, that really made me feel really good afterwards. So it's really important, and this applies to everyone else. It's really important that you take time for yourself, and do stuff. If you can do exercise, go out there with your mask or something like that, that's great. But anything that you enjoy, can take time, that you find pleasurable, it's really important during this time that we do that. So that has been one of the major coping strategies we try to teach.
Doctor, one of the things that I think is important in this is, this is really important in your position, because I found here at the city that, this, we don't live in a bubble. We
Mhm.
had a number of employees, many in our police department, but also in public works and other departments that tested positive for COVID, some that were hospitalized. Thank God, none that passed away, but
Good.
but they also have their own families. They also have work responsibilities. The city cannot close down. We still had, policing, permitting, things
Yeah.
to do. Businesses still had to run.
What they
So
call essential workers.
correct, essential workers. And one of my questions to you, because and talking to our manager, I told him how important it was to motivate our team. And
Mhm.
one of my, I guess one of my questions to you that are on the front lines: how do you motivate your team? How do you keep everybody,
Yeah.
being optimistic in the midst of a crisis like this?
And as a leader, you always try to communicate with your staff and let them know. But I think there was a really concerted effort to have a lot more communication with our people from all the leadership levels. I would send people, weekly update what's going on. We had meetings much more frequently by Zoom, of course, which we can argue now. There's a lot of anti-Zoom movement, but all our leaders started having a lot more meetings to keep people informed of what was going on. We started having events, Zoom events, and we had mixed reviews on that. Where if there was social Zoom events, we had a Zoom happy hour, for example, and everyone had their wine. Some other Zoom events where people just talk about their personal lives. Tell me what was one thing about you we didn't know. Those kind of things to try to keep up employees motivated and engaged during this time. I think having a strategic plan from leadership and addressing this head on is key to do this. Not everything worked. Like I said, some people weren't thrilled with this. Let's talk about our personal stuff in Zoom, but a lot of people are very happy, and they saw us that we're trying to keep with that. And then we did a lot of mental health specifically. We made a lot of mental health, our employee assistance program, a lot of stuff. What one of the things that was a little bit upsetting to me, it's we're fortunate we work at the University of Miami, but not every employer can do this. The small businesses and things like that, they don't have access to these resources. I know the CDC, I know the Florida Department of Health has some information out there on mental health during the COVID. And that's when people call me from other places. I've been telling them to try to access those resources and have those tips, because I know, especially the small businesses, they've really got hit really, really hard during this epidemic. And I know it created tremendous stress among their employees, and they don't have the resources to do this. So that was really hard. And I got a lot of calls from patients in those scenarios.
The other facet of that to me, I can tell you from my experience, was complicated. Is we have my wife, and we have three girls, 25, 21, and 10. Same wife. Okay, just I want to be on the record on that. But one of the interesting things about the process was, my job required me to be out there, uh, food distribution, being here at City Hall, trying to do my other regular job also. So I was out, let's say, a lot more than my wife's a teacher, and one of the girls is a student, one is already working, and the other one, obviously, is the little one, is now just back to school. But you mentioned before that you took a little time where you wanted to, because you were dealing with issues, and you at home, it makes it very difficult. How do you motivate your family members in this time of crisis? Because in my case, I can tell you, we saw that the big spike as a public policymaker occurred when the graduation started and teenagers started going out and college students started going out. How do you motivate your family members, number one, to listen to the issue and number two, to deal with it?
Yeah. Luckily up, and again, I have my son is a Cane, by the way.
Good.
He's now yeah, he's a junior now at the University of Miami, but my daughter's a high school senior. Goes to Coral Gables, and so we were dealing. There's two phases. One in the summer where they had all these plans to do things. They have both got accepted into really good summer programs. They're all excited, and suddenly that was pulled out from them. And then they're coming back to school. It hasn't been a normal coming back to school. Mine's are still online for most of the trainings and everything. I think the mask part, so one is the safety precautions. I mean, it's key. I mean, one of the saddest things we as doctors have seen was how a simple mask, where's mine? how this became political, right? This is not political. I mean, this is a responsibility. Not only protect ourselves, but to protect others. The key thing about masks is if you're positive, preventing other people from getting it. And I know some kids have had different responses. Here at the University of Miami, it was a little bit hard in the beginning. There were some of these parties, but I think we've done a good job. And thank God the positive rates among students, they've been listening, and my daughter has been at well. But the other mental health stuff, I've encouraged them. Look, guys, you got to do something else. You got to go out. You got to do exercise. They've done good with their friends in Zoom, but they'll tell you it's not the same as going out. It's not the same as the socializing events. If you can imagine, for University of Miami student, clearly it's all about the academics, but there's a social component there as well, and they no longer have that. And so that's been hard, and you try to encourage them. Now they're starting to go out now, obviously wearing masks, small groups, taking all the precautions up, and that has been positive. Wash your hands frequently, alcohol, if not soap. And so we've allowed them to do that, but it was really hard, especially over the summer.
One of the things, doctor, that for me is, obviously for everybody, has been this change has, after a while, maybe at the beginning it was unique, and then it became mundane, and then it became a little bit more difficult. But I'm a big, believer, and my daughter yesterday, actually the little one, read the announcements for the first time at school, and she talked about the growth mindset. Something Carol Dweck out of Stanford had talked about. But I'm a big believer in, a fan of Martin Seligman, who began the positive psychology movement over at the University of Pennsylvania. And the issue of trying to maintain a positive attitude, a happy attitude in a crisis is not easy to deal with, because different people have definitions of what happy is, number one. But number two, to have that positive attitude when every news story that you turn on is pretty negative, whether it's politics or medical. How do we help our community stay positive and happy in this time of crisis?
Yeah. And again, that goes back a little bit. We tell people, a couple of things. You have to find a sense of meaning and self-worth in this, right? They have to do something that's positive. We encourage people, some of the activities you said, for example, you worked on food delivery campaigns, right? You did a lot of those. I had a lot of people who actually ended up doing stuff like that and trying to help out other citizens. They found tremendous amount of joyness and satisfaction in that. There's many ways you could contribute. So that's one of the strategies we try to tell our patients. Okay, you're not working, you can't go to work, but try to find something positive you could do and a way you could contribute to this epidemic. I know people that started making masks from home and distributed them, and they found a lot of happiness. Okay, I'm actually doing something. I think one of the big things is that people that are used to hard work and doing stuff need a sense of self-worth and need something to be doing. And that's it. I also remind them that even when they do things on their own, I live down south, and a lot of people started going out with their families and bicycles and everything. You're not only doing that for yourself, you're doing that for your family. Okay, you as the leader of the family, taking everybody and doing things like that. When I see people doing that, you're actually doing it for your family's health. So even that in itself is not only helping you, but you're also making a contribution to the positive health. People got to find something that they feel good about and they feel positive, or it's going to lead to a lot more depression and isolation. And it's not always easy, but that's one of the messages we try to instill.
Yeah, I think that link between physical activity and mental health, which is critical. And I don't do as good a job as I should do about it. I play basketball, which is one of the things every Saturday, but I haven't been able to do that in a long time. But it's interesting that you should mention that, because one of the things I've seen in Doral, and I think this probably applies, and you mentioned that living down south, you've seen it too, but I've certainly seen it in Doral, is the increased physical activity of people that maybe otherwise wouldn't have done it. If there's something positive that is going to come out of COVID-19, and I'm not saying there aren't others, is maybe people have taken the time to analyze a little bit more what's worth it in life and maybe refocused on their health. And I've seen all sorts of people, all ages out there walking, running, cycling. Mm-hmm. And I think that's a good thing, in my opinion. If there's a positive coming out of a negative, that is one.
We doctors, we probably haven't done a good job at selling it, but the studies are clear. When you have a patient with either major depression or anxiety, regular exercise every day is almost as good as taking medication. Right. I mean, it's an incredibly, incredibly strong health benefit. we always tell people, yeah, do exercise, and then we right away start writing medicines. But maybe we should do a little bit more pushing the exercise. And certainly during this time, that's what we've been doing.
Yeah. You talked about obviously your children and their plans for the summer were a little bit thrown off, and I've got we've got the three girls, and as you know, with kids, none of them have the same personality. The three of them are very different. And I, in particular, with our little one, who has, loved part of this process because she spent so much time, on the computer, but playing, during the summer.
Yeah.
And
Yeah.
I try to get her out because I try to say, hey, listen, you got to go out and do. She's playing a little golf, doing a little exercise, and that didn't really happen during this time period because of the restrictions. So, how do a layperson like myself, how do you how can I motivate my three daughters, different ages, to during this period, to tell them, hey, this is a learning experience. Let's take something good out of it. Let's not fall into a trap that we don't. How can I do that? How do we can do that as lay persons?
Yeah. Well, first of all, if you ever find the key to how to motivate teenagers to do what you want them to do, and you put that in a bottle, sell it, you will become an overnight billionaire. So, yeah, good luck with that. But it's really hard. You have to sell it. You have to sell it. So one is obviously the positive value of doing it for everybody. It's not just about you; it's for us as a family, and that's been really hard. But sometimes you just got to let them do what they enjoy. We as doctors, especially my friends over in pediatrics, hate the video games, hate the kids, hate the motivation. During this time, it's a little bit more leeway, right? You can't, some of these things that we have on them, they're home all day. My son, he's going to kill me for saying this, but he's a little bit of a geek. Dungeons and Dragons. Every Friday, he would go to and play Dungeons and Dragons with his friends that are big, and then they had to move it to online. And so suddenly they're doing D&D online and talking. We're fine with that. That's okay. It's something they enjoy. It's something that keeps their minds off. So trying to be a little bit, it's got to be all healthy stuff, right? I mean, certainly no big parties, certainly no masks, stuff like that. But teenagers has always been the hardest group. But giving them a little bit more latitude, but explaining that this is all part of the coping mechanism and stuff we have to do, and not coming as hard as them stuff like that. But it's a challenge. I mean, but not only for kids, I mean, I just, motivating the adults has also been a challenge. But we see it in our employees as well, how to keep them engaged, how to keep them integrated. Always trying to find things to do, even they're working from home. We got to give them something to do. Okay, work on this, work on that. There's no easy answers. I mean, you run a big government agency. How do you keep your employees motivated and engaged during this time? So it's not just, not just the teenagers, but they are the hardest nut to crack.
Yeah, that's one of it's interesting because you mentioned Dungeons and Dragons. I had never played it. And then my 21-year-old, who apparently also is very heavily into this, got us all as a family to begin a Dungeons and Dragons game. I had never really played it. So I want to ask you one question that, my wife has been a special needs teacher in Miami-Dade County now for almost, 28 years. She just went back and it was very difficult, in particular for elementary school special needs students, which is the group that she teaches, to have them really learn through, this portal. In particular, maybe the older kids are a little bit different. But I mean, do you have an opinion and do you have suggestions? Because, her situation is our 10-year-old obviously is a regular student, but the kids she teaches are special needs. But I saw some complexity and difficulty even watching my 10-year-old trying to have classes through this modem. What's your opinion on that long term? Or any thoughts in general on that issue?
Yeah, and it's one of the questions that the media always wants to know: should they go back to school or should they not go back to school? And special needs, I would almost consider carve out. So, it's clear. One, there's a lot of reasons you want your kids to go to school, the least of which being that the parents also have to go to work and can't be home with them. And it's clear, no matter what kids tell you, that, in-person learning is probably better. There's some kids that do fine with online learning, and we've had online learning before for certain kids, even before all this happened. But most kids will prefer, go to school. Although some now are telling me, well, I don't have to wake up as early or something like that. But in general, but special needs is a totally different. I would have almost, and again, I don't want to, I'm not an educator. I don't do education policy. But if there was some way I would have carved out, because the special needs are very different from normal kids. I would have found a way. I don't know how, but I mean, and it's hard because you have to treat education uniformly. Those kids, I would have tried to find a way, to do something that was more one-to-one, more personal, and not through online. And I know it's hard, and I know with the school superintendent opening up schools, those are one of his highest priorities to bring back. So everyone recognizes it. At the same time, it'd be horrible if one of these kids got COVID.
Yeah.
And
Yeah,
it's a
absolutely.
horrible balance. But I'm not an educator, so it's not an area I'm an expert in. But certainly, we do know that, the impact on them, and when they fall off and don't do their, the routines that they got accustomed to, it's very difficult and disrupting. If there was some way to treat them differently as a carve out from the regular school population, and I think the superintendent's trying to think about that right now.
Yeah.
But not fácil,
Yeah,
like we say, not fácil.
yeah. She just went. My wife just went back to this week, obviously, and I think she would concur with you that that's easier, not only the teachers but also for the students and even the parents of special needs children feel that way. I think it may not be the same, for let's call them regular students. Or, I think I have, as an elected official,
Yeah.
unfortunately, in the modern world, uh, social media, all these other things, abounds with rumors and different pieces of information and things that may or may not be true on the political side and other side. But also, I got peppered with a lot of questions from the pro-mask, anti-mask, pro-opening, anti-opening crowd, and they're the two extremes which seem to dominate discourse in America today, in my opinion, unfortunately, because I think the majority of us are in the middle trying to be reasonable and sane, but it's not what the 24-hour news cycle, 24/7 news cycle, and the internet really deals with. One of the things that I had to deal with is the issue of people that would tell me, well, you're following what the CDC says, but they're wrong, or you're following what Fauci says, and Fauci is this and that, and the other one, no, Fauci's the one that knows it all. How do we deal with these different pieces of information?
Yeah. I am so glad you brought that up. We just got a big grant from the NIH's critically, basically to address COVID, what they call misinformation and miscommunication. And so I've been going around doing a talk about how you battle that and how you address that. So I'm so glad you brought it up. And people send me all sorts of crazy things. Now that they know that it's my job, they think I'm the guy fighting misinformation. I saw a video recently from, I think it was a church ministry or something. It's really sad. A guy who sounded very medical, talking about how wearing a mask make you hypoxic and raises your cortisol levels, and you're dealing into this histotoxic substances from the mask. I, as a doctor, know that's absolute false and not true. I was going to use a four-letter word, but I know it's totally not true. But if you're a regular person out there, this guy sounds, medical words, big fancy words. He must know what he's talking about. So my heart goes out to people when they're faced with this. And obviously, again, not politics aside, but when you see the federal government spewing a lot of this information, it's really, really hard. How do you address that? And when we've had basically the whole COVID thing, a public health issue, become political. When in the world have we made a major public health crisis be political? And depending on whether you're red or blue, how you behave and how you act, which is not based on it. And it's really hard. Unfortunately, a lot of people at the CDC, in the Department of Health here in Florida, they've been muzzled, and there's certain things they can and can't say. But if you go to the online material, most of that is actually good. What's online from the CDC, the NIH now just released a whole website of COVID resources that have been vetted as true information. And, everything that we hear, everyone agrees masks are critically important. One of the things we as doctors are cringing, and we are afraid of this third wave coming up now, is all this thing about not wearing masks and not doing social isolation and all these rallies, but all these other events that are going on, because we're really scared that we're about to hit a third peak right now. Hand washing is absolutely safe, and social distancing. You also need contact tracing. Those are, there's no debate about that. These are things that are true. Every doctor, whether he's almost every doctor, they're red or blue. I mean, we have a lot of red doctors, but they're going to tell you this is exactly what you need to do. So you need clear, concise, simple messages that people understand. The challenge has been, as you said, with both the federal government being complicit in this, but also with a lot of social media. It's really hard. We tell people, most people ourselves don't want to spread false information, right? What happens that we lose our filters. We get something from my friend in Facebook, and right away, hey, I got to tell everybody about this because the 5G towers are causing coronavirus, and we have to stop all these 5G cellular towers. Something crazy like that that makes no sense, and you immediately hit it. Our filter is a lot less. Please try to think before you forward something. Where's that source coming from? Is it a credible source, or is it your cousin's friend's brother who heard this from something and is suddenly posting it? So is it credible or not? Where does it come from? What I'm telling a lot of people, it's when you get something from, that's credible, don't tell people, hey, you are wrong. This is the truth. Show empathy. Let them know, look, I understand you're really worried about COVID. I understand that, you see these big towers popping up next to you and you're related. But the truth is that actually, but you have to show some empathy in your response. Don't try to shut people down. And the other thing we tell people, when you send them, have them read the stuff. Look, this is what the CDC says. What do you think about it? Rather than, trying to correct them bluntly. So there's strategies that we notified information, misinformation. It's not, it's hard. And there are some bad actors. So most people are good. They're not trying to spread something that they saw on Facebook to, spread but there are some people, there's some bad actors that are deliberately spreading misinformation. And that's the most dangerous part of this. So NIH is key on this. I just saw our medical students got an award from the Association of Black Cardiologists to also follow misinformation. We as doctors, is one of the most scary things. And that's what makes our heartbeat go up, especially as we may or may not enter this third peak.
Yeah, that brings me to another point that I think that you've got a lot of expertise in, and I'm really curious about this because, our community in Doral is in large part, primarily Hispanic. Mental health, the importance of mental health. Many times in the Hispanic community, it's I'm not going to say it's a stigma, maybe it's becoming less of a stigma, but I think Hispanics in general, that's kind of like the last frontier of the medical area that we accept as an important component of living in this earth and being happy. So what advice would you give, to a mayor like myself, who is the mayor of a predominantly Hispanic city, when I talk about mental health to my community?
As you said, the stigma of mental health is tremendous, especially los Latinos, que estoy loco or something like that. Again, I try to bring it back. Everyone has mental health issues. There's not one of us that doesn't have mental health issues. Maybe this is, TMI, too much information. As I tell people, people come to my office and they hear me talking, they're like, who are you talking to? I'm like, I'm just talking to myself. We all have a certain level of dealing with stress and a certain level. It's an issue that affects us all. It's not a yes or no, it's a continuum, and people got to understand that. The other thing people understand is that mental health is a medical disease. Depression has to do with serotonin levels, absolutely. Schizophrenia, there's certain biological things. It's not a, lack of will or lack of fortitude. These are real medical problems, just like heart disease, just like diabetes, just like, high cholesterol. It is an absolute medical condition. And I know we as Latinos have a hard time understanding that. We think some things must be wrong. But they're definitely medical illnesses, and they need to be addressed as medical illnesses, which is key. But in terms of stress and coping and anxiety, that's for all of us. I would think almost you have to be crazy if you're not stressed out, anxiety, and depressed over what's going on. Absolutely, I would say that. So it is normal. All these things are absolutely fine, but the severe forms we can't treat because they're medical. And it's a hard message to try to convince, people, because of our culture, our background, so stigma, that this is accepted. Psychiatrists will tell you when they train, they all get psychotherapy. It's not because they're crazy, but it's part of their training so that they understand this, and it's part of what's healthy for everyone. So there's no stigma associated with it.
A follow up to that question is, I think that one of the things that's occurred during COVID, is different ways to cope with it. Obviously, faith or mindfulness, whatever you want to call it, or meditation. I've read some studies on, in particular, transcendental meditation and its impact on coping with stress. Obviously, mindfulness has become, I think, probably a much more popular word, I'd say, in the last 5 to 7 years. And I think it's a good thing, by the way. But I think there's there's different definitions and different understandings of what that could be. Beyond the health, do you think some sort of mindfulness, sort of
Yeah.
centering exercise is good for people, and not only in a crisis, I guess in general, but particularly during this
Yeah.
time?
So before COVID, right, we had all these, provider burnout was a major issue, even before COVID. And so we had certain tools, what we call recharging, that we did. And actually, in our residency program, they made it mandatory that every resident who was training with us had to spend 45 minutes a day on one of these recharging things. Mindfulness, this whole non-judgmental awareness, which is what mindfulness is really, at the present moment. That was one of the key strategies that was laid out. And there's websites where you can go and read about this. The other one, so mindfulness, I'm a big fan of that. But the other one is relaxation techniques, yoga. There's other imagery, progressive muscle exercises you can do. All these are critically important. And so we actually mandated it to our trainees. We're trying to get it for the faculty to also get on board now and do this as well. But these are things everybody should do. There's time out, 45 minutes every day to practice some form of recharging. Again, exercise is one, but relaxation techniques, mindfulness techniques, yoga, something. You really have to do something. I mean, that's the only way to keep sane.
Yeah, I think that, we have a program here in Doral. We have a great program for our employees, but we've also had a program called Get Fit Doral, and we try to add those three components, which was not just exercise, as important as it is. We added nutrition, and also, the mental aspect of it, because we felt that that's kind of like the three, like the chair with that's held up in those three pillars. And I think it's extremely important. One of the things as
So
as
there
a
you go. Let me
mayor.
just cut you off 1 second. I mean, because there you go. That's a perfect example of something, because we have it for our employees,
Mhm.
Doral. How do we bring that to the rest of the population? Provide trusted websites. I mean, if somebody looks at your website, I'm sure it's much more trustworthy right now than other things. And let people know these are the mindfulness techniques. These are the things you can do, and making those tools available to everybody. I think those are the things, and that also helps with the stigma. If
Right.
the mayor is promoting this, and the mayor's putting this on his website, and all these things, those are really key things, because I worry, like I said, I worry about us, the big employers, having all these tools for our people. But the small businesses and the people that are self-employed, they don't have access to this stuff. So that worries me. And the more we can both do about that and make it available to the general public, that would be absolutely wonderful.
Well, you'll be glad to hear that we, in our Get Fit Doral program, which we started many years ago when we founded the city, and I was the founding mayor before I came back. That program, we expanded it, where we had trying to get the city of 1 billion steps and have people participate and try to track their walking. Now, the interesting part is, during this process, we had nutrition classes. We partnered, people would go, and there would be free classes for residents to go to Publix or Winn-Dixie and learn how to read, for example, anything that you're buying. We also had partnered with some of the mental health providers in the city to talk about to parents and to children and to others about things like mindfulness, and things like you mentioned, really ways to really feel better and more positive. And obviously, we had a component of different, Zumba classes, our 5K that we do every year. So I did, personally, I would do a walk with the mayor program, where I would invite the neighbors to meet me at a park, and then we'd walk around for, get at least 10,000 steps. So I totally agree with you that it does no good if just large employers keep it within, and that information doesn't get. And I can tell you, as a mayor, that's always felt that, you build the city from the top, from the bottom up, not the top down, which to me is a message I tell all my residents. It's not about the mayor, it's not about the council, it's not even about the administration, it's about all of us being the city of Doral. We built it from the bottom up, not the top down. We are, and a perfect example is our 5K. When we started our 5K years ago, it was just a very regular event. Now it's grown a lot. Now there's a lot more professional runners in it too, but it's still an event that draws, and we have a large health fair geared around that. So I think we as elected officials and as public servants have also an obligation to try to do that, and partnering with, institutions like yours and the University of Miami and others is critical. I want you, as a public servant, as a mayor, uh, I always tell people we can't do everything. Hispanics in particular, many of us come from countries where the governments are very centralized, and the answer to everything is go to the government. I believe that in the United States, we're a little bit different, and that's good. Not everything is solved by the government. There are private institutions, there are public institutions like yours. And I think what becomes important is, can you, the All of Us research program, uh, and what you're doing with COVID-19, can you tell me what resources, let's say a city like Doral or another city or somebody who's in the public sector as a public servant, tell us about the program, tell us about what we can do to work with you and to get that program to be effective in our communities and all around South Florida.
Yeah. And before I answer that, let me just backtrack, because we didn't talk a lot about nutrition, and you brought it up, and I'm like, how could I not have talked about nutrition? Right. I'm seeing a lot, one of the really major downside effects of anxiety is people eating a lot more junk food, a lot more stuff. They're home, they're anxious. We've seen diabetes, cholesterol levels go out of control, and clearly healthy nutrition. We have a lot about just increasing fruits and vegetables, not about putting people on a diet. We don't even say don't eat that. It's just increase the amount of fruit and vegetable intake. Everything that's there, tons of healthy stuff. But clearly nutrition is a major part of it. So I'm so thankful you brought that up, because I totally forgot. That's the other aspect of it. The All of Us program, it's critically important, but it's also part of our major campaign to increase the minorities who are participating in research. But All of Us is one perfect example. All of Us is an initiative across the United States to have 1 million people. What we're going to do is we're going to sequence everybody's genes. We're going to link that up to their medical records, and we're going to link that up to a lot of stuff about the communities where they live, a lot of data we have, because we really need a very robust database to see how genes are linked to environmental exposure is linked to health outcomes. So it's a critically important program. What's happened traditionally in medicine is that us minorities, Latinos, African Americans, we have not participated enough in these research studies. Many of the landmark trials, we know diabetes affects Latinos 3 times more than non-Latinos, yet all the landmark studies were done without Latinos. I'm like, how could that happen?
I have diabetes, so I know.
Yeah, exactly. All right, so perfect example. So, how many Latinos were in those drug studies that, tested? So it's a major thing. Right now, we're doing COVID vaccine trials. And at least the first phase is that minorities are not being adequately represented. Well, we know minorities suffer more from COVID than other groups, that we're not being adequately represented in research. So it's important when these discoveries linking genes to the environment, to health outcomes, that our people are adequately represented in these studies. So All of Us is one example about how we do this. And we're trying to add now, because we planned it before, but with COVID, a mental health component. So we actually have mental health questions and link those. How are those linked to, to your genes and to your exposures and to your environment, linking to outcomes? So there's a lot of key important questions. But the important thing for us, Latinos and everyone else, is to participate in these studies, because otherwise what we find out won't be applicable to us. Everyone says, oh, but all our genes are the same. Where we work, our environment, with COVID is an example. I mean, we know, genes are similar, but, certain groups, because they're essential healthcare workers, for example, because we live in much more crowded housing, because our exercise diet patterns may be different. We want to make sure that the vaccine is equally effective for everybody, not just for people that practice, work and live differently from us. We don't want a COVID vaccine that works on somebody who's been home socially isolating for the last 6 months. We want a COVID vaccine to work for the essential healthcare worker that has to be out there in the field. So it's important that we're adequately represented in all these medical studies. All of Us is just one example. We think a lot of the major discoveries in the next 20 to 30 years are going to be impacted based on discoveries of this 1 million person cohort. Well, we want to make sure we're adequately represented in that cohort.
How do we, if one of our residents, for example, who might be seeing this on our website, has an interest in being part of this and listens to your words and says we want to get more minority participation, how do we reach you? How do we get information on the program?
And that's why we have Rebecca. I think at the end, she's going to show all this information.
Oh, good.
Rebecca, and we're actually starting a tool. So typically, if you wanted to be part of a study, you would go to All of Us website, for example. If you wanted the COVID vaccine, you go to COVID vaccine. As of today, University of Miami is making a major initiative to make it much more easy. And I don't know if Rebecca has that information already. Any research study, and you see if you're eligible for it. But yeah, I mean, it's critically important that people participate in this. And we're trying to make it much easier because it's been a major concern of us as a leader. We're, a minority majority city. We've been for a long time. And it's up to us here in Miami to be a leader in ensuring addressing this problem for the rest of the nation.
Rebecca, how would someone like me as a resident of Doral who's interested maybe in participating in one of these programs, either the COVID-19 program or it might have another resident also interested in one of the programs, how do we get that information?
Yeah, of course. So for the All of Us research program, we have a base here at the University of Miami, as Dr. Carrasquillo has mentioned. So we are going to post the website in our bio, but basically just go to joinallofus.org. It's pretty easy to remember. And you can learn more about the program there and also learn how to sign up. And as also Dr. Carrasquillo mentioned, the University of Miami is launching a new website that will house all of the different research programs and studies that are associated with the University of Miami. And that we will also put in the link, the bio, but it's umiamihealthresearch.org. So again, we are going to be featured on there as well as other COVID-19 studies that are taking place right now at the University of Miami.
And it's important for people. A lot of times they're like, oh, I don't qualify for these studies. I don't do. All of us are pretty much open to every adult, It's very easy. The COVID vaccine studies are open to every adult. So there's a lot of things that, almost all people can participate. Certainly we have studies that are just for people with diabetes, for example, and people can look at that as their diabetes study. I qualify for it, but there's many other studies that are open to almost everybody. So we think it's a good tool, but I think, a lot of us have the stigma about research, about being guinea pigs, and I don't want to participate in them. But I think it's critically important that we're represented. One of the lines we're trying to tell people about the vaccine studies is we need some heroes to prove that this vaccine is safe and effective. And it's a public service for you to be one of those people that's contributing to the public good.
Yeah.
So it's important.
I think I can only speak for myself, but I years ago I did one on diabetes and vitamin D, and I did it because I said, hey, I want to find out the link if that actually helps me, doesn't help me, and but I think that Hispanics, like you said, many times in particular, maybe aren't as cognizant that this is something that helps everybody else, but may help you too, as you go through the study. So I hope that what we can do, Rebecca, too, is make sure once we put this on our city website, hopefully we can also put those links directly to both programs for our residents, because I am sure there's a good number of residents in Doral that would be interested in participating.
Yeah, of course. And
Yeah.
Oh, go ahead.
No, that's it. Go ahead, Rebecca. I'll sign up for you.
And following along with posting about our research programs, we're also going to be posting multiple resources that are there for people who want to learn more about mental health. So we're going to be posting stuff about the Substance Abuse and Mental Health Services Administration's Disaster Distress Helpline, and also the National Suicide Prevention Lifeline for anybody who may need that. Because as we all know right now, we're not alone. We're all struggling in different ways. And I think having conversations like this is especially important right now.
Definitely agree. And I thank both of you and you for doing such a great job and giving us an opportunity as a city to benefit from this knowledge that we're talking about today. We're going to hopefully get this out. We will get this out, not hopefully, to our residents so they can not only have access to the resources, but also to our conversation today. Dr. Carrasquillo, you've been fantastic. You've answered a lot of the concerns. I can tell you that as a public policy maker, as a mayor, I'm always seeking to learn how to help our residents. And this is an area that obviously, I have to rely on the knowledge of people like you. And but it is an issue that I think is going to be, I think it's going to be, like I said at the beginning of this conversation, mental health, I think, is going to be an increasing issue for public policy leaders across this country in the upcoming months.
Thank you, Mayor. I think, Mayor Bermudez, all that you're doing, I'm so glad we have public leaders like you out there and, taking the charge and taking some of this head on like you're doing. So thank you very much for all you do.
All right. Well, thank you both so much for participating today. I know that I personally have learned a lot and maybe a little bit about your personal lives as well. And I personally play Dungeons and Dragons myself, so it's good to know that it's becoming such a worldwide game. And I just wanted to thank everybody who's tuning in today, learning more about mental health, especially in this pandemic. Like we said earlier, we're going to be putting all of our links in the bio, but if you do have any questions specifically about the All of Us research program, we can be reached at 305-243-8380. And again, as Dr. Carrasquillo mentioned, in order for all of us to really benefit from health research, we all need to be represented. And that's why the University of Miami is very proud to be a leading partner in this study, because we want to help ensure that the future of healthcare reflects the rich diversities that are found in our communities. All right, well, thank you again, everybody, for joining in today. And if you do have any questions, feel free to add them in the comments or send us an email, and we'll be more than happy to answer them for you. All right, take care.
Bye.
Bye, Mayor.
Bye.
Bye, Dr. Bye, Rebecca.
Bye.